I am live. It is Saturday afternoon. It is the 31st of August 2021, and I am still in chapter 4, which is a chapter written by Denys Kelsey. This is a collaboration between Joan Marshall Grant and her then husband, Denys Kelsey. The Supraphysical in Medicine. Joan has also spoken about the supraphysical in chapter 3, and we are continuing here in his description of his patients who he treated with hypnosis and so on. Two examples of this mechanism were furnished by Joan. Obviously, they would have been more telling if they had concerned patients who had no knowledge of our ideas. But if Joan's faculties enabled her to recognize a mechanism in herself, it will be easier to recognize when it is occurring in other people. The first occasion was when I decided to try to find out why Joan, when reading or eating in bed, always lay flat on her back, her legs out straight and only raising her head a few inches from her single pillow. This worried me because of the obvious danger of choking when swallowing in a supine position. I also knew that she had already scolded herself severely enough to be kept in bed for 10 days and scarred on the neck and chest for several months, when her thumb had slipped off the handle of a mug of nearly boiling soup. Whenever I reminded her to sit up, she did so, but when alone would revert absent-mindedly to her habitual position. Matters came to a head one day when I found her drenched in orange juice. Suddenly I realized that her posture reminded me of that of a patient who is paralyzed from the waist down. I mentioned this to her, and she told me of an incident which had occurred when she was 4 years old. She had been running ahead of her nanny to open a massive oak door at the end of an avenue in her parents' garden. But the door had been taken off its hinges for repair and had been left propped temporarily in position by a plank. The plank had slipped when Joan touched it. She remembered the door falling towards her, trying to run, being knocked down by a blow between her shoulder blades and then lying trapped face downwards. A gardener had tried to lift the door off her, but it was so heavy that he could not do so until 2 other men arrived to help him. The nanny lifted her up, and when Joan said her leg was hurting, the nanny, who must have panicked, stood her on it to see if it was broken. It was. Joan felt it crumble under her, and then she fainted. She retained a vivid memory of the difficulties in the healing of this fracture, which had necessitated her leg being kept in plaster for many months. But she had no recollection of a fact about it, which had later been told, that for 3 weeks it was feared that she would be paralyzed. As her 4th and 5th thoracic vertebrae still show signs of an old fracture, I presume her spinal cord had been bruised. When I asked Joan to shift level, I anticipated that she would recover details of this period of paralysis. But instead of regressing to her childhood, she found herself identified with a girl of 20 who had been paralyzed from the waist down in a riding accident. This girl was an earlier personality of her own. Her Christian name was Lavinia. She was English and died in 1875. She was married, but not to me. As by this time I was familiar with hearing Joan reliving episodes from earlier lifetimes as matter-of-factly as though she were telling me about some incident from her current one, I was startled when she exclaimed, "Bring me back fast. I'm getting so closely identified with Lavinia's paralysis that I'm afraid it's affecting my own legs." In a couple of minutes she had returned to normal waking consciousness, but she could not move her legs. This was a new and most alarming experience for her, but she remained sufficiently detached to tell me to put my hand on her back to discover which muscles were out of action. Although I was already familiar with the concept of the supraphysical body, I was not yet fully alive to the importance for treatment of distinguishing between it and other aspects of the personality. Therefore, I told her to shift level again to try to find out more about the circumstances of the accident. She did this in considerable detail, the essential information being that Lavinia had been locked in her bedroom by her husband to prevent her riding to hounds on that particular morning. His motive was jealousy, because she had danced too often with a young man whom she had met for the first time at a hunt ball the previous evening, and her husband was determined she should not meet him again. Lavinia had climbed out of the bedroom window and so reached the stables only to find that all the horses were out except a young stallion that even her husband dared not ride. She saddled him with the aid of a reluctant stable boy, who cannot have tightened the girths properly, for when she was in sight of the hounds, rebellious and triumphant, the side saddle slipped as she was taking offence, and both she and the horse suffered a heavy fall which broke her back. As I assumed that it was Lavinia's anger against her husband which had caused her to fail completely to integrate, I concentrated for some hours on trying to bring every facet of such feelings to the surface. This approach had no beneficial effect whatever, and Joan's legs were still useless. Finally, she said, Lavinia's body will never be able to go until you have healed it. The idea of healing an earlier supraphysical had never previously occurred to me, so I had to act intuitively, turning Joan onto her face and telling her to shift level so as to be receptive. I placed my hands on her back in the region which I hoped corresponded with the site of Lavinia's fracture. Then I made a vivid mental picture of such an injury, telling Joan that I was going to drive energy through her body into the supraphysical of Lavinia. I have noticed that when attempting any kind of healing, I feel on some days that I'm being more effective than on others. And there's also a sensation that, for the time being, I have done all I can. I experienced this after about 10 minutes and told Joan that Lavinia's fracture was now healed, and that she would find that she had now regained the full use of her legs. Soon she was able to move them, albeit rather feebly. I then told her to return to the present day and normal waking consciousness. We both assumed that this was the end of the incident, for her legs were soon functioning normally. However, the following morning she told me that during the night she had found it difficult not to resonate to Lavinia, and had twice woken to find that she was suffering a reoccurrence of the paralysis. But as these symptoms had subsided after she had switched on the light, and read for a few minutes, she had decided not to waken me. That afternoon I again sat beside her while she shifted level. Again she identified closely with Lavinia, and we learned many more details about the 3 years she had been confined as a cripple, either to her bed or to a chaise-longue in her bedroom. There was a recurrence of the previous session's symptoms, so I repeated the same technique. Suddenly, Joan exclaimed, now I can see Lavinia getting up from her bed and walking freely. There's no need to do any more. She then fell peacefully asleep and slept until early the next morning. Thereafter, Joan no longer assumed her supine posture, and now alters her position as spontaneously and frequently as would anyone else with the normal powers of movement. But there was another feature which I found equally interesting. The first Lavinia session had ended when I told Joan that the injury suffered by her earlier supraphysical had been healed, and that therefore she would be able to use her legs normally. But the fact she had again resonated to Lavinia during the following night with a recurrence of symptoms indicates that the return of function had been due only to my suggestion. By contrast, the second session had ended when Joan herself declared she could see Lavinia moving freely, and after this there was no relapse. So it seems reasonable to conclude that Something was achieved in the second session which had a validity of its own, was not merely due to my suggestion, and affected Lavinia at least as much as it affected Joan. A year or so after this episode, Joan was bitten on the corner of her left eye by a mosquito. There was considerable swelling and some discoloration, but nothing which would not have cleared up in a couple of days without recourse to antibiotics. She told me that she was feeling a degree of pain and alarm which was entirely disproportionate, and that as she had suffered the same exaggerated reaction to a mosquito bite which affected her eye on several other occasions, she wanted me to do something about it. She added that mosquito bites on any other part of her body were never more than mildly annoying, and that when working with her father in his mosquito control institute, she had often given mosquitoes blood meals from her arm as part of her job as his laboratory assistant. Within a couple of minutes of shifting levels, she said, "I died of an insect bite. That is why I'm so frightened. He was an Egyptian captain about 25 years old. He was bitten on the eyelid while he was asleep by a fly, not by a mosquito. His face is terribly swollen and covered with suppurating scabs. I think he must have septicemia." She was becoming distressed, so I told her that I would perform on her face the sort of surgical toilet which I would have performed on the face of the Egyptian captain. Then, taking a piece of moist cotton wool, I began gently to swab her forehead. Suddenly she announced, "You are not doing it the right way. You should have two pieces and swab afterwards from the center, so there is no smearing." I carried out her instructions while her degree of identification increased. "I'm in a torment of anxiety. If I die, my men will be left without a leader. I am trying to force my brow and cheek apart with my fingers in order to see the little crack of light which tells me I'm not blind." Then suddenly, in a normal voice, "You should be doing that with water and a white linen cloth." I fetched a small bowl of water and one of her white linen handkerchiefs, which I wrung out and laid on her forehead. "No, it must be kept moving." At this point, I set myself to make a clear mental picture of a face in the condition she had described, and visualized myself performing a meticulous, careful toilet upon it. After about 10 minutes, she said, "That is much better, but you have missed some of their scabs. There are some still left under my hair and in my nostrils." I added to these, and soon she said, "There are no scabs left now. He's healed. He was a fine-looking man, but there is still something wrong with him. There is a hole in his skull. One of his comrades must have trafficked him." I put my hand on her head at the place she indicated, and visualized the wound as closing. After a few minutes, she gave a deep sigh of relief and said, "Everything is all right now," and fell peacefully to sleep. When she woke after 3 hours, she had no further pain or apprehension, and the swelling of her eye had practically subsided. When we come to look back on these two episodes in some years' time, my effort of treatment may seem somewhat naive and crude, but I think the concept of trying to heal an earlier supraphysical may seem to have contained the seed of a contribution to the treatment of a variety of conditions, as so many psychiatrists have been moved to exclaim, "Insight is not enough. Insight does not necessarily imply cure." And this is understandable, for if the symptom is coming from a source which, on its own level, is as real as a stone in the shoe, and a great deal more dynamic, relief will depend not on the mere recognition of its presence, but on its removal. The supraphysical body became for me an almost tangible reality on the 4th of February 1960, when Joan was undergoing a small exploratory operation. The procedure itself was trivial, but the issue at stake was not, so it was a time of considerable anxiety. I had accompanied her in the elevator to the operating theatre and remained with her while was injected. Pentothal was injected. Immediately she was unconscious, I returned to her room as she had previously asked me to do so. I was sitting in the armchair thinking of her very intensely when I felt her come and sit on my knee. Never before had I realized that anything immaterial could seem so solid. I knew she was telling me to get a pencil and some paper. I did so and returned to the chair. Then Joan began to dictate. There was no sensation of a voice talking to me, but ideas were being communicated as directly as though by speech. The material concerned a patient who had just come under our care and was soon to prove exceedingly relevant. I was kept writing at full speed for some 20 minutes, and then a nurse came in to prepare the bed for the patient's return. Just as positively as I had felt Joan settle on my knee, now I felt her leave. This is the end of chapter 4. The next chapter is by Joan again. It's entitled The Cultivation of the Senses, and it's chapter 5.